Good afternoon, everybody. Thank you so much for joining us. Welcome to Roswell Park's webinar for first responders. I'm Rebecca Vogt. I'm the Media Relations Specialist here at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Now, we know that you guys as first responders spend your careers selflessly putting the safety of your community first. However, we want to make sure that you're taking just a little step back to focus on your health as well. Your job puts you at a significantly higher risk for chronic diseases, including cancer. And the focus of this webinar series is to provide support and education to keep all of you healthy. Now, today I am joined by Dr. Mary Reed, who is the Director of Cancer Screening and Survivorship here at Roswell Park. I'm also joined by Michael Valenti and also Tim Downs, and they are both the President and Secretary, respectively, of the Firefighters Cancer Foundation of New York. Mike has also been an active member of the Syracuse Fire Department for the last 16 years. And Tim's video, it isn't on, however, he will field some questions later or even pop in if Mike has to go out on a call. So with that, Dr. Reed, Mike, and Tim, if you would like, could you please share a little bit about yourselves? And I guess we'll start all off with you, Dr. Reed. Unmute yourself, Dr. Reed.
My name is Mary Reed. I'm a cancer epidemiologist, and I'm the Chief and Director of Cancer Screening and Survivorship at Roswell Park. I have a long track record of working with first responders and firefighters throughout Buffalo and the area of Western New York. And I'm particularly interested in the kinds of exposures that are related to cancer in first responders.
Fantastic. Mike?
Hi, my name is Mike Valenti. Been a Syracuse firefighter for, it'll be 16 years in August. We started the Cancer Foundation of New York just over 6 years ago when we lost 3 of our firefighters in a 12-month period, and we joined in with the Firefighter Cancer Foundation. And our work here is to just try and educate and help every firefighter, first responder, and their families that are dealing with the issue of cancer and the diagnosis of cancer.
Thank you for that, Mike. Tim, I don't know if your microphone is on, if you would like to share anything.
Sure. Can you hear me?
I can.
Okay. I've been with Syracuse Fire for about 35 years. I retired in 2006, and I've worked at the training division, helped put out materials, and I had a long interest in cancer with firefighters. I'm a survivor myself, and I've known Mike for quite a while, so we kind of got together on this, as Mike said, 6 years ago, and we're enjoying our work.
Fantastic. Thank you, everyone, for those brief introductions. Now, moving forward, our goal at Roswell Park is to create comprehensive programs for screening and treatment of our local and state first responders. Dr. Reed has been very, very passionately advocating for early interventions for years, and today she's going to talk to us about paying attention to your risks as well as what services are available to you. We will leave some time open for questions following her presentation, and I know that Mike will also be providing some regional and state updates as we wrap up our webinar. You can submit questions through the chat feature below, and we will try to get to as many as possible as our time allows. And with all that, we get to pass the mic over now to Dr. Reed, who has her presentation.
Thank you very much. It's really a pleasure to be able to talk today. So I'm going to talk about paying attention to your risk. Next slide. So a little bit of a background on cancer. You know, our cells normally replicate, and you know, as the picture shows, they get to a certain point, and in the normal process, cells sort of reach the limit of their lifespan, and we have normal mechanisms within our body that kill those cells off and allow them to be shed. And that happens in multiple organs and in our blood as well. When something happens to the DNA of a cell that shuts down some of these control mechanisms, it replicates out of control. And this is sort of a basic commonality that most cancers have. And as the cells replicate and replicate, they either take over normal functions of cells in our blood, or they form tumors, which go on to be detected. Next slide. So this is just, I happen to be a lung cancer researcher, but this is just an example of what happens in the normal lung. You have normal epithelium, and you see all this on the left side of the screen, the nice organization of cells, the cilia that help us to move mucus and get particles out of our lungs. And then as cells are damaged, and in this case, they were damaged by smoke, you can see that the structure of the lung tissue gets progressively worse until it becomes very thick and inflamed, and eventually moves on to what is really an early cancer. But you can see that this growth is unregulated, and this is when someone may progress on to lung cancer. Next slide. This is just a picture of a lymph node biopsy, which actually shows how even in non-solid tumors like lymphoma, leukemia, myeloma, you see this invasion of these abnormal cells. And again, this is this uncontrolled growth where the function of the lymphoid tissue and the function of blood is impaired, because you have this huge infiltration of abnormal cells that continue to replicate. Next slide. So there's some basic things to remember about cancer, that it really takes, years or decades to develop. And, again, I'll reference smoking. Reference smoking. When you've smoked for 20 or 30 years is usually when you are at risk for developing cancer. The same with some other types of exposures, and even with diet and stress. That is a very long process, because our body still can detect cells that are bad, and our immune system jumps in, and so it may take repeated exposures, again over years, for cancer to form. We have the natural mechanisms to detect cancer cells that have an abnormal DNA, and our body and our immune system can attack these cells and get rid of them. And that is what normally happens. It's when tumor or cancer cells develop, they're very cunning, and they develop ways to get around this detection. And that's why cancer research is continually evolving to figure out these escape mechanisms that cancer cells develop. Cancer is multifactorial, except in very, very rare cases of very specific, mostly chemical exposures, or very specific mutations that we inherit from our families. This is a multifactorial. There are lots of factors that contribute, so that you could be someone who's highly susceptible for cancer, but it takes another insult, either an environmental exposure or age, which is a risk factor, in order for a cancer to develop. So very rarely is it a single cause. The other exposures include the environment we live in, our personal lifestyle, this inherited susceptibility that we get from our lineage, and immune responses, and the health of our immune system. Next slide. So common risk factors for cancers, you've heard these before. Age is the single biggest risk factor for cancer, and so as we age, you typically see cancer becoming more frequent. At some point, this may change as you get into your 80s and 90s. We don't see as much cancer, but then people succumb to other causes of death. But age, as you get older, for instance, with lung cancer, regardless of people smoking at a young age, the average age is 70 for a lung cancer that's developed without any specific inherited problems, and that's even among smokers. Smoking is a huge risk factor for cancers. It really accounts for 1/3 of all cancer deaths in the US, and then particularly in New York State. Family history is another. So this is not the inherited mutations, but if you have a family with a lot of cancers in multiple generations among first or second degree relatives, that can contribute. And it's not necessarily all genetic. It can be a combination of genetic, lifestyle, sort of some of the cultural norms within your family. Occupational exposures is a big one, and this is really the topic of today. So that we're typically in jobs for a long time, and if those jobs incur occupational exposures, you get that decades-long exposure that really helps to drive cancer. Lifestyle, obesity is related to cancer. Lack of exercise, poor diet, those are all factors which we know contribute to cancer rates. Chronic inflammation from people who have chronic intestinal disorders or inflammation of the lung. Those are examples that those can lead to cancer and increase your risk. Stress. I'll put a plug in again later, but we know that stress has more to do than just how it makes us feel, but we know that there are some physiologic effects of stress, especially on the immune system, and that'll be the topic of our next webinar with Dr. Opaski from Roswell Park. Genetic inheritance, so that we can pass mutations that put individuals at specific risk for cancers. An example is the BRCA genes related to breast cancer. And if you have a mutation, you increase your screening frequency. You look for this inheritance among other family members to know if it puts them at risk. We're learning more and more about the effects of mutations on multiple cancers, and using that information to enhance surveillance. And then immunologic disorders, so that we know more now than we ever have the important role of our immune system in challenging abnormal cells and helping our body to address getting rid of these cancers, or at least containing these cancers. A lot of the newest drug regimens are about enhancing the activity of the immune system to at least have some cancers contained, so they don't grow and they don't impact the survival of their host. Next slide. So among first responders, and it's we're using the broader definition. Obviously, some common diseases that impact both the quality of life and also the length of life among first responders. So cardiac-related death is still a big issue, especially for firefighters, because of the gases that they're exposed to, and just in our lifestyle, as in the U.S. and really around the world, cardiac-related events like heart attacks and strokes, are still very much a part of our life. Again, these happen more frequently with older folks, 50 on up, but it is definitely one major cause of mortality and morbidity among first responders. Coronary heart disease, which again tied very closely to diet and stress and smoking, but again that's up there in terms of causes of disease and mortality among first responders. The kinds of risk factors that we know are more common and lead to other conditions: age, diabetes, family history, high blood pressure, smoking, high cholesterol, obesity, stress, and lack of exercise. And those are all mediable risk factors, which we can do something about. Smoking is a major risk factor. Again, I'll try not to mention it too many more times, but it is really a big problem. Over the years, we've had a hard time understanding exactly how many first responders were smokers. It's not something that people in general like to report, but we know from our latest data that with the younger recruits coming in, that they are less likely to be smokers. They're less likely to take up smoking during the course of their occupation as a first responder, and that is a very good sign, because smoking can only complicate the other exposures you get as a first responder. Next slide. Again, stress, we are learning more and more about not just the psychological impact of stress and what it does to our quality of life, but we know that stress can impact certain metabolic pathways that block the immune system from really unleashing its full potential to address cancer. Again, I would stay tuned for our next webinar on this topic. It's extremely interesting, and it bodes well for us to really address stress, especially in your professions. Next slide. So the studies of cancer among first responders. Next slide. There isn't a great body of literature, I must say, and I'm actually starting with police because I think the feeling is, in terms of occupational exposure, that they suffer a less intense exposure than firefighters. We reach out to several police departments throughout our region. I also think that when you look on the TV and you see a response to a fire, you always see the firefighters with equipment. They're not always wearing it, but they usually have it. But you never see the police who are also standing around near a fire or an accident or a spill. They are not usually protected by equipment. And I think, so if we think of police as being less exposed, I wanted to present this data first because I think it's really compelling. So again, police have higher risk of health problems, including heart disease, diabetes, metabolic disorders, psychological stress, depression, suicide, sleep disorders, and cancer. And we see among some of the studies, there are about 14 in the literature, where we see an increased mortality on a broad span of cancers, particularly colon, kidney, digestive, meaning your intestinal and your stomach and your esophagus, male breast cancer, testicular cancer, as well as Hodgkin's lymphoma. Next slide. So a study was done that followed 2,234 white male police officers in Buffalo, and it went from 1976 to 2006. The population was followed for 31 years, and the primary endpoint was to look at the incidence of cancers across the board, all types of cancers. And in the process of the 31 years, 406 officers, or just over 18%, developed cancer during the follow-up period. Next slide. Next slide. So the cancers for the overall cancer summary risk was similar to the population of white men in the same kind of age range in the U.S. and the local white male population. However, the risk of Hodgkin's lymphoma was 3 times. So that equates to 300% increase of Hodgkin's lymphoma among this group of police officers in Buffalo. The risk of brain cancer was increased by 60% overall. But when you looked at years of service and you stratified by 30 years or more or less, you found that, again, there was a 300% increase of brain tumors in these police officers who worked for 30 years or more as police officers. So there is definitely a dose effect in terms of their exposure to whatever it was that was causing the brain cancer. The rates were lower among this group for skin and bladder cancer. So in general, one of the takeaways is that we saw an increase, really dramatic, of Hodgkin's lymphoma, which is a serious disease. It's a liquid tumor. It requires extensive treatment. Survival is reasonable, but it's an extensive treatment. And brain cancer. And again, when you hit the 30-year mark of service, you really saw an increase in that risk 3 times. So next slide. So just in general, Hodgkin's lymphoma, and I'm listing what the regular risk factors are for Hodgkin's and non-Hodgkin's lymphoma. And again, age, being female, African Americans and Asian Americans actually have a lower risk of lymphoma. Chemicals and radiation, nuclear radiation is a big, one of those single exposure causes of lymphoma that does not take decades to form. Certain agricultural chemicals like arsenicals have been linked to lymphoma. Immunodeficiency, again, that issues with the immune system, autoimmune diseases, infections, breast implants, increased body weight and poor diet, and HIV infection. And this is a pretty serious disease. And again, when you control for all of those factors among police, you still see that dramatic increase in risk of lymphoma. Next slide. So switching to firefighters, and the literature among firefighters is much more extensive in terms of cancer. And I'm just going to give a couple examples. In San Francisco, which has about a 16% of their firefighters in the city are women. It saw 15% of the female firefighters in the department who were between 40 and 50 were diagnosed with breast cancer. That is 6 times what you would expect of women of the same age and the same race, but the only difference is that they're firefighters. The idea that you get exposed to all these chemicals through your skin, through your respiratory system, and they concentrate in the fat of breasts, and this led to breast cancer 6 times increased among these women firefighters. Now, normally with breast cancer, the average age for the general population is 60 to 65. That's where most women develop breast cancer. So not only were firefighters who were exposed were younger, but you would not expect this kind of frequency of breast cancer in this type of population. Again, in 2008, over the next 10 years, and this report came out in 2018, 250 San Francisco Fire Department active and retired firefighters had died of various forms of cancer. And again, way in excess of what we would expect for the general population. Next slide. So I want to talk a bit about the World Trade Center and what we can take away from this horrible event was that we actually are able to observe what happened to first responders over the years since that happened. There were 1 million tons of dust that rained down over 16 acres. There was asbestos, freon, many carcinogens. There was caustic fine concrete and cement dust, and a mixture of sulfuric acid, which was the byproduct of the combustion. So the dust itself was really loaded with both irritants for the airway and also things that we know are direct carcinogens. Next slide. And 36,000 rescue workers have been evaluated over the years since the event. And what we saw is that among people who were responders to the World Trade Center, 42% recorded some change in the respiratory function. And these events were usually seen within the first year after 9/11. And the degree of impairment was related to a cumulative exposure on the site. We estimate that the response to World Trade Center equated to about 12 years of active duty. And again, looking at your own firehouses and fire departments, you can sort of gauge who are these long-term firefighters and see what, in a busy place, what their exposure might have been. Next slide. 19% higher risk across all of the first responders at 9/11, 19%, so 20% increase. Cancers of the skin, prostate, thyroid, lymphoma, myeloma, again, are popping up. And we, view these cancers, these blood cancers, as really kind of earlier signs from a severe exposure. 15% again were newly diagnosed with asthma. 77% of responders reported a new wheezing, cough, shortness of breath. And the more time they spent on site, the more extreme these symptoms were. Next slide. So there was a specific study because of the rates of myeloma, multiple myeloma among World Trade Center first responders. There were 16 cases diagnosed after 2001. The mean age was 57. And compared to first responders in Minnesota who did not respond to the World Trade Center, we see an 80% increase in risk of myeloma, again, a very rare cancer in the first responders compared to the Minnesota public and firefighters. Next slide. And in terms of aerodigestive conditions, there's an array of aerodigestive conditions, again, because obviously the lung is the first site to be directly impacted by the dust from the site. And you can see that it's most of these you may not have heard of, but all of these conditions are related to inflammation from the exposure that causes problems breathing, causes problems exchanging the air. Many of these were long-term, they did not resolve, and some of them have not resolved in the years since 9/11. But again, it's all related to the inhalation of the dust from the site. Next slide. Since the World Trade Center Act was initially started, it was amended to include a variety of other cancers because, again, driven by the kinds of cancers that were seen in the first responders. And I know it was in the news this year that the act was extended to provide benefits to first responders impacted by cancer related to their exposure at the World Trade Center. But these cancers now covered really go from not just in the mouth and in the lungs, but really go throughout almost all of the organs: kidney, bladder, breast, ovary, childhood cancers, and really rare cancers like myeloma. Next slide. So what can you do about this risk? So, you're in a profession which, hopefully you love and you want to stick with for a long time and grow in and appreciate, but what can you really do to mediate your risk? Next slide. So the things to think about in determining the impact of being a first responder on your risk of cancer include a few things that you have to evaluate for yourself. So how many years have you been working? And again, we need to appreciate that the longer you've worked, the more exposures you get. What are the kinds of exposures that you get on the job? If you're a volunteer and you're working mostly in rural areas, you're looking at barns that may contain pesticides and other things you don't really know. There's a lot of homes, there's a lot of new building materials. And if you're working in a more urban environment, you get really a mixture of some of these old industrial sites, old factory, old storage facilities, to homes that may have high levels of lead and other heavy metals, to new construction, the whole gambit. And so you really need to look at what those exposures are, cumulatively over the lifetime of your work. Were there any big bad exposures that you remember? We've already seen some of the patients, some patients who were in the responding to the chlorine fire on Niagara Street a couple years ago. That was extremely toxic fire, and we know that there have been some cancers that we think were associated with that exposure. So looking at your history, whether you're a policeman or whether you're a fireman or an EMT that you've gone to that were particularly bad in either the character of the smoke or what was burning, or the length of time you stayed there, and other illnesses that you see associated with that exposure in your colleagues. What's your lifestyle look like? Do you smoke? Are you even a light smoker? Do you vape? Do you eat a healthy diet? You know, we know fruits and vegetables and decreasing meats, but do you have that kind of variety in your diet that gives you the micronutrients and vitamins that you really need to be healthy? Do you exercise? Do you control stress? Are you within the proper weight? All of these things also contribute to your risk of cancer in addition to your occupational exposure. And what other factors do you have? Do you have a family with a lot of cancer in it? Did you have childhood exposures? Were your parents both smokers? So were you exposed to a very smoky, you know, kitchen table growing up, even though you may not be an adult smoker? And so those are things that you need to evaluate. And do you go to your primary care provider annually? You know, and this is important, and I'm going to talk a little bit more about that. Next slide. Go to your primary care doctor. This is really important. You know, I want to say as an aside, so I, as a white, overeducated, very well-nourished female, I expect people like me, 1 in 7 will get breast cancer. And the older I get, the more common it is to get breast cancer. Eventually, you know, as I get more into my 60s, that ratio will be 1 in 6 and 1 in 5. Now, there's certain factors that I can't do anything about. I can lose weight, I can eat a healthy diet, I can decrease my alcohol consumption, which is already pretty low, but you know, we know that it's a risk factor even at low levels. But the main thing that I can do is to have a mammogram every year, because there's a lot of things about me. I don't have cancer in my family that I can't change, but the things I can change, I have a responsibility to change, but I also need to get a mammogram every year. So when you go to your primary care provider, whether it's a nurse practitioner, a PA, or a physician, you need to tell them you're a first responder, this puts you in a different category in terms of the exposures and the things that they should be looking out for. Next slide. So I'm going to go into a little bit more detail, but you know, we've worked with several primary care physicians. One of them is running the screening program with me at Roswell, Dr. Tisa Flores, to come up with information that you can take with you to your primary care. And we're making these into pads that will be in the local stations and firehouses. You can request them from us. We're happy to give you a pad that you can tear off this sheet and take it with you to your primary care doctor. We also, at this website, Roswell Park Screening Prevention Cancer Screening First Responders, these exam recommendations you can download and print and take it with you to your primary care physician, because we want you to have an enhanced physical exam. Next slide. So what does this include? When you see your primary care provider, you need to detail any symptoms that you're having that are changing. You need a full physical exam, not just a respiratory check, not just a cursory listen to your heart, but you need a full physical exam. If they are not inclined to do, you know, these are busy practices, you need to either change primary providers, or you need to stress that you have to have a full physical exam because you're concerned about your exposure as a first responder. You need the vital signs measured. There are certain laboratory tests, and I'll provide that detail in a minute. You need to have your lung function evaluated. And if it's different than the last time you were evaluated, you need to know that it's changed. Early signs of lung cancer and restrictive lung disease is that your pulmonary function, your ability to breathe deeply and force that air out, one of the early signs of those diseases is change in lung function. You need to have a stress EKG at some point during your work as a first responder. Again, we know cardiovascular disease is related to your job, but we also want to get a baseline. We recommend a chest x-ray every 5 years and to stay up on cancer screenings. So if you're approaching the age of 50, or if you have a family history, actually it's 45 now. If you're 45 or older, or you have a family history of colon cancer, you need a colonoscopy. You can do this testing your stool, or you can have a full colonoscopy, which is what we recommend. If you're 50 and you smoked at least 20 years, we recommend that as a first responder, you get a low-dose CT. We do that at Roswell. It's done within many places within our region. They know how to do it and how to read it, but that's an early detector for lung cancer. For women, they need cervical exams, breast exams, and mammograms. And that once you hit 40, you should have a mammogram every year. If you have any changes to your breast, you have a strong family history, or you're noticing some physical symptoms, you go to your provider and you ask for them to give you a mammogram. And for men, a digital rectal exam is really important for picking up early prostate cancer. So one thing we know about the cancers that we can screen for is that if you pick cancer up on screening, it's usually earlier. If you wait until symptoms, it can be later. And that getting it early means that you can oftentimes get a cure. The impact of that cancer on your life will be much less than if it's already outside of the cavity, if it's metastasized, you've gotten extreme symptoms, and it will have a bigger impact. So we really strongly recommend cancer screening. Next slide. So this this is just showing you how much information we think that you should be getting out of every annual exam that you have with your primary provider. Picking up a lymphoma or myeloma can be done by looking at some routine blood work. It can also give you an idea about the adequacy of your diet. We really strongly recommend that you talk to him about cancer screening, again, because you're at increased risk of some of these solid tumors. We want you to be a little more proactive. Again, primary care physicians do this. You don't need additional money from your town or your program or your provider. You just need to get an annual physical exam, which most insurance companies pay for. We also know there's legislation in the state of New York that is going to obligate all insurance providers to do this kind of full exam for first responders. It was written specific, it's tailored to this kind of approach of getting a full assessment annually by your primary care provider. If you don't have a primary care provider, you can always come to Roswell Park for screening. We'll do all the screenings you're eligible for, and we'll help you to identify a primary care provider. Next slide. So there's information that you can get from us. We're developing screening events for skin, prostate, and breast cancers that you can come to. We'll advertise these. They're very easy. One day you'll get your results. For people, for first responders who are younger, who are below 40, getting a skin check is always important to do. We have a high rate of melanoma in people from our region who like to go and tan in Florida. You also get a lot of skin damage from being outside. And we think also the susceptibility of first responders to getting exposed on the surface of their skin puts them at risk for non-melanoma skin cancers. And so getting a free screening is a great way to get started into this idea of early detection. We also have a screening clinic at Roswell. We do a full physical exam like we've outlined. We refer you to any of the screenings for which you're eligible. We're doing some additional research on trying to detect multiple myeloma in any first responder that we see. If you call the Roswell number and tell them that you're a first responder, they will get you plugged into this program. We have a brief screening series of questions to ask you so that we get an idea of what kind of service you've been doing as a first responder, and then you can get an appointment from us. We have an online screening questionnaire. We have links to that on our website that will give you an email and let you know what cancer screenings you're eligible for. Next slide. And that questionnaire is, again, screening, prevention at Roswell Park, and cancer screening for first responders. Next slide. So, in summary, it's important to be proactive. You have a great profession. We want you to be healthy and to stay in it for as long as you want. And in retirement, we don't want you to suffer the consequences of having done the work you did. We want you to be your own best advocate. We know that it's important to stand up for yourself and to let your providers know what you need as a first responder. We want you to pay attention to your body so that you know when your breathing changes. You know when you have some pain that doesn't go away. You know if you see blood. You know if you are getting up in the middle of the night repeatedly. And those are changes that you need to pay attention to. We want you to fight the impulse to ignore symptoms, to put it off, to wait until there's a better time, because your body is telling you something that you need to pay attention to. And that if we didn't pick something up during the last screenings, we want the opportunity to pick it up during your next cancer screening. And there are many services available to you, both through Roswell and through your local community. There are online services to let you know what your risks are, but you should take advantage of these services and be proactive. Next slide. Thank you very much for your time, and I think we will be fielding some questions.
That is correct, Dr. Reed. Thank you so much for that very well detailed presentation. And we do have a couple of things coming in. One question first that has popped up, and it says, if you are a non-smoker with 20 plus years of smoke exposures as a first responder, when is a low dose CT recommended?
So it's recommended when you are at the age of 50. That is when we know the guidelines match that. So 20 years of smoking, when you turn 50 as a first responder, we can order the CT for you, and we are very confident that you'll have no problems with your insurance. I want to put a little caveat. If you have symptoms, if you have shortness of breath that's increasing, if your respiratory assessment that usually happens annually has changed, talk to your primary provider to see if you should get a CT earlier. The ones we do when you're 50 are really screening, but if you have symptoms, you can get it earlier through your primary care provider. But we will order one at the age of 50 for you.
Fantastic. One very poignant comment that came through in our chat, someone saying, I'm a prostate cancer survivor at this time. I can't stress enough that firefighters need to have a PSA test in addition to the DRE. If I hadn't had a PSA, I wouldn't be here right now. So kind of to morph that into a question, why are both of those needed for prostate cancer, the PSA and the DRE? And if you can just kind of explain for maybe some people who don't know what each of those are.
So I'm sure that if you've ever had a DRE, you know it. It's actually a manual exam of your prostate to see if there's any enlargement, sensitivity, irregularity in shape, any nodules. It's done through the rectum. And a PSA is a blood test looking for a specific protein that from an inflamed prostate gets spilled into the blood. The reason why we recommend both, it used to be you were just screened with a PSA, is because that led to a lot of interventions that were not necessary. And so now the thought is that combining with having a physical abnormality and symptoms with PSA. So the DRE plus a PSA is the best way to get to accurately get early prostate cancer, so that you don't have stuff done that you don't need to do. Blood test seems easier. You want to make sure that you're also being seen by a provider.
Fantastic. One question I kind of want to loop in with one other one that kind of go hand in hand. And also, Mike and Tim, if you feel like, in your own experience, any of this sort of pertains to you as well, you can absolutely feel free to jump in and answer as well. But one question that is coming through is, should first responders be taking multivitamins? Would it be worth it? And that kind of links up with the question that we have about, like, is there anything else proactive that first responders should be doing in order to, keep a track of their health right now, even if they don't have any symptoms? So I guess we'll go multivitamins first and then other proactive steps.
So, whether you take multivitamins is kind of, it's definitely a personal decision. I personally don't take multiple vitamins, but I really try and round my diet out with a mixture of different meats and, different sources of carbohydrates and lots of fruits and vegetables. And, if you're on the go and you're less likely to get that diversity, you may want to take a multiple vitamin. I think and there's lots of stuff online about what is a balanced diet, and I think you should make use of those recommendations. But the main idea is that having a good diet promotes a healthy immune system. It promotes healthy weight. It promotes a lot more energy. And if you're working different shifts, and it's hard to stay awake and high energy, but the diet definitely contributes to it. And it is one thing that we can control. So, we know that we don't recommend fast food. We know that we don't recommend a lot of alcohol intake. And, those things, I think, no one really wants to hear that, but that's really what we have to say. But, if your diet isn't well-rounded, to take a multiple vitamin.
Great. Hey, Tim, yourself as a cancer survivor, is there anything that maybe you could add on what you have done, sort of any lifestyle changes maybe that you've made?
Not any necessary, well, a better diet. I've started to eat some things I didn't used to eat, which is good. And the first part of the question was, the whole idea of delayed detection. I was playing around with a nodule in my neck, and I put it off as something else for quite a long time. So it ended up being stage 4. So my whole thing is talking to other firefighters is just to be proactive in that way. So that's my experience. I waited too long, so I had to go through a little bit more.
Thank you for adding that in, Tim, and for being such an advocate. A couple other questions we want to throw out there. We do have a little bit more time. So talking about Roswell Park, does Roswell Park see patients from across the state for screening and whatnot, Dr.?
So we do. We'll see anybody. We understand the importance of being seen by your local providers, but I think once you start to get into this, it's good to, we can definitely offer a comprehensive first step into making sure you're being screened appropriately. We will do what we said on those forms and pass that information on to a local provider. So if you're, central New York, we definitely are happy to see you at Roswell, and then to engage you with a local provider who will keep up the standard of physical exam and cancer screening that we've started. We know there's issues with insurance and being out of network, and it's something you definitely want to check out. And that's really why we made up this form, so that if you can't drive to Buffalo, you can at least get this information and take it to your local provider. And, I really want to stress that a local physician or nurse practitioner who does primary care should be happy to see this information and tailor the physical exam to your exposures. These are things that need to be on their radar. It's not maybe something that you've ever said before. And it's okay to just go and say you want this full exam without having to have a symptom to promote it, because this is about health maintenance and prevention. And you definitely want to get a baseline. So even if you're 25, or 45, you need to get that full exam, even if it just shows what the baseline is. And, I think in general, people are better about getting annual exams if they have concerns. So, but this should be something that supports you having concerns, so that you see someone every year for a checkup.
It is good to be an educated consumer and an educated patient. And I'm sure physicians probably appreciate that too, when you come in, with the questions and taking charge of your own health. Maybe a question to pass over to Mike. I mean, how can someone start the process with the Cancer Foundation?
Well, we've developed a great relationship with Roswell. And if somebody should contact us, whether it's through our website, Facebook, anything, what we can do is, if it's you yourself as a first responder, your family member, or whoever, contact us. And we have a direct link into Roswell where it'll help streamline the process of getting in there. It's an amazing relationship where we have had people that, they're afraid to contact Roswell or any other center because they thought the process was too hard. The link that we have with Roswell, the relationship, we can streamline that, and you really get in the door quickly and effectively, and they'll do everything they can to help you.
And I think you touched a little bit upon it, Mike. You had said that basically anyone, who's connected to it, whether it's, a spouse, someone's kid can reach out to you as well, right? Because I think, as you had mentioned yesterday to us, is that, everyone's part of this brother and this brotherhood.
It is. It's the brotherhood, the sisterhood of firefighters, first responders. It's not just about us. It's our families. One thing we've learned is sometimes bringing our gear home, bringing our dirty, contaminated equipment home. We're bringing this home to our families, and to see family members and younger children of the families getting sick, and it could possibly be because of us. So that's why it's not just about the first responder. It's about everybody we're in contact with. So if there's anybody that needs assistance, just get a hold of us, or get to your primary doctor to get into, and get the screenings and help that you need.
So very well said, Mike. Thank you so much. As we get very near to the end, I'm going to sort of open it up to the floor. Mike, I think you have a couple of updates you want to share before we wrap it all out. So I will, pass the mic right back to you.
Just want to let everybody know that this is our first run of this. And we hope that everybody talks to, people around to spread the word of what we're doing. I can't emphasize the relationship with Roswell, that you've done this and for us, and we can't thank you enough for doing that. We're going to be doing more of these in the future. We want to do one a month, throughout the summer, throughout the fall. What we had planned on doing was a large education day back in May, where we were going to have multiple oncologists and speakers from Roswell. And unfortunately, we couldn't do that because of the current situations. But instead, we took another route to this, and these small interactive, webinars we think were the right way to go. And hopefully, come November, or sometime in the fall, we're going to do a full day of education, and get as many people involved as possible. So I just can't stress that if you saw this today, please pass on what you saw, and the next time we do this, bring more people to the table and help educate everybody around us.
I feel like Mike is taking away my job as moderator. I mean, you could just take the stage now, right? I mean, you said so many things that I plan on saying as we wrap it all up. Thank you for that. Dr. Reed and Tim, do you guys have any final thoughts you would like to share?
I'm fine.
Tim, anything you would like to add?
Dr. Reed, just thanks again so much. You've been kind of with us every little step of the way over the last couple of years. And Looking forward to the next one, because that was one of the questions I asked you directly about stress. I just sense in the fire service and the way things are in life in general, the more we could learn about that, the more better we'll be prepared to take care of ourselves. So thank you so much for this and
Sure.
continuation.
It's a pleasure.
Fantastic. And yeah, I know that Tim alluded to it, which I'll get to very shortly, just some of our other webinars that are coming up. But first, I want to extend a huge thank you to Dr. Reed, Mike, and Tim for all joining us. And then also for all of you guys viewing out there in the audience. I mean, whether or not you're taking time out of your day, if you're on shift or if you're at home, we really appreciate it. And I think we also heard too that some of the stations are also sort of tuning in as a whole, as a group. So yeah, we really appreciate that. And we hope you got a little bit out of this today. Now, if any of your questions weren't answered, we do encourage you to tune into these future webinars that are going to address even more topics and questions. Our next topic will be effects of stress in your immune system, as Tim had mentioned, and that's going to happen on Thursday, July 23rd at 1 p.m. Again, Thursday, July 23rd at 1 p.m. We do consistently update our first responders resource page at roswellpark.org/first-responders. I'm just going to take a pause for a minute because I did see that Mike unmuted. Is there something else that you want to add?
Well, I just want to let people know, if they want to get a hold of the Firefighter Cancer Foundation of New York or the Firefighter Cancer Foundation, our national organization, we have an 800 number, and it's 866-411-3323. And anybody can call that, whether you're a first responder or family member. Or you can go to our website, which is ffcancer.com or ffcancerny.com, and talk to us and reach out to us, and we can help you.
Communication in so many aspects is key, especially here when it comes to taking charge of your health. And that's why we were here today for all of you. Now, speaking of which, if you didn't catch all of the things that we rattled off on how you can watch, etc., what you can click on, websites, what have you, you are in luck, because the video from today is going to be available to view on demand on our First Responders resource page, which again is roswellpark.org/first-responders. We were able to shorten that for you so you can get to it a lot quicker. And then also the link is going to be sent to your email, and you can pass that along to anyone who maybe wasn't able to tune in today. And if you want to kind of nudge someone and say, hey, you know, tune in, this is really important, take some notes, go for it. We really encourage that. And we also encourage you to stay tuned to roswellpark.org/first-responders webinar. Again, roswellpark.org/first-responders webinar, and also your email to register for upcoming webinars, which will again happen monthly, as Mike had mentioned, and we are so excited to continue to bring those to all of you. I'm going to wrap it all up by saying we hope that everyone has a wonderful day, and thank you again so much for tuning in. We'll see you next time. Bye.